Manual refraction. In this session, you will learn how to determine a spectacle prescription by Maifest Refraction using a plus cylinder phoropter and clear patient communication. Refraction is a bit of an art, and there are many variations that lead to a final prescription. You will learn the basics of refraction in this session. As you progress in your career, you will add on to this basic knowledge and refine this skill. Our goal for performing a manual subjective refraction is to measure the refractive error by introducing lens options in front of the eye so the patient can also participate in choosing the lens power, which provides clear and comfortable vision. This is a subjective test, so you will need cooperation and feedback from your patient. So the components we measure are sphere power, cylinder axis, and add power, depending on the patient's need. There are other less often prescribed features of glasses prescription, such as prism. These specifications are critical to the glasses prescription, but they will not be explained in this session. If you see other specifications, like prism on a previous glasses prescription, it is recommended that you get assistance from your doctor. Now we will look at a standard manual phoropter. The phoropter looks like a complicated contraption. To simplify what you're seeing here, let's first focus on the three areas where you see numbers for the basic prescription: sphere, cylinder, and axis numbers. The spherical or sphere power is usually located on the far right and left of the phoropter. The sphere number on your left is the sphere power for the patient's right eye, and the number on your right is the sphere power for the patient's left eye. The cylindrical, or cyl for short, power is located closer to the lower center of the phoropter. Again, the cyl number on your left side is the cyl power for the patient's right eye, and the number on your right side is the cyl power for the patient's left eye. On phoropters, for both the sphere and cyl powers, plus power or hyperopic prescriptions, the numbers are usually in red. Minus power or myopic numbers are usually in black. If the cyl power is printed in black, you are using a plus cyl phoropter. The axis is usually on the lower dials next to the cyl number. There are markings around the entire dial. However, the dial is split into two sets of 180 degrees, one set on the top half and the other on the bottom half. The axis markings are in 5-degree increments. The axes markings are the same 100 degrees away from each other. Often, you will start by inputting into the phoropter a starting prescription. This is usually one of the following: the lensometry reading from the patient's current or habitual glasses, the last prescription given, the last Maifest refraction, the retinoscopy determination, or the autorefractor reading. If you have none of these and the patient has good vision, at or near 20/20 uncorrected, you can start with the phoropter at 0 sphere and 0 cyl. With 0 cyl power, there is no astigmatic correction, so you can ignore the axis position. If there is a cyl power, you must also input the axis position. Set your phoropter up with your desired starting point. You will use the autorefractor reading as the starting point. Now let's look at some of the dials on the phoropter. Using the large dial on the left side of the phoropter, input the sphere power for the right eye. Move the dial down for more plus and up for more minus. The knobs to adjust cyl power and axis are usually located together. The front part of the knob closer to you adjusts the cyl power. You can feel the knob click into position. Turning this part of the knob clockwise increases the plus cyl power, and turning counterclockwise reduces the plus cyl power. Use the knob closer to the face of the phoropter to input the axis. This knob turns smoothly. Remember, the markings are in increments of 5 degrees. Next, we'll input the autorefractor reading for the left eye. Again, the large dial on the side is for the sphere. On the lower dial, the part closer to you changes the sill, and the part closer to the face is for the axis. At this point, it is recommended that you try to practice inputting various prescriptions into the phoropter, so you become comfortable with quickly dialing in a starting point. Now that we have a starting point dialed in, align the phoropter with the patient. Be sure the patient is sitting in a comfortable and aligned position. Set the vertex distance. This is the distance the lens is from the patient's eye. You want the distance to be the same as the distance of the spectacle lens to the patient's eye. This is especially important for patients with high prescriptions. Next, level the phoropter. For most phoropters, you will center the bubble. Adjust the pupillary distance so the patient's pupils are centered through the oculars. Adjust the forehead rest so both the patient's head and vertex distance can remain stable. Check that the patient has a good view of the acuity chart through the phoropter. Looking at the auxiliary wheel, set the eye you are starting with to the open position and occlude the other so the patient is viewing with one eye, usually the right eye, or OD. Most of the time, you will refract one eye at a time, starting with the right eye. Dim the room lights. Make sure you have the proper eye open and the other eye occluded. Sit on the side of the patient so you do not obstruct their view of the acuity chart. On the acuity screen, isolate an acuity line size, which is 1 or 2 lines above the smallest row red. Be very clear and concise with your directions and what you are expecting from the patient. I'm going to show you a couple lens choices. Please let me know which lens choice makes the letters look sharper and easier to see, even if there is a slight difference. Sometimes both choices might be blurry. Just continue to choose the sharper option. If the choices I show you look the same, tell me they look the same, because that's an acceptable answer too. This is typically the order of refraction. First, sphere power. Second, axis, then cylinder, and finally return to and recheck the sphere power. Determining the initial sphere power. Using the big wheel on the side, always introduce plus power first by moving the wheel in the downward direction. Move the dial down a click. This is choice 1. Now move in the minus direction by moving the wheel in the upward direction to your starting position. This is choice 2. Ask the patient, which is sharper and easier to see, choice 1 or choice 2? If the patient likes more plus, continue in this direction until the previous choice is sharpest. If there's any confusion, ask if the choices look about the same, and give the most plus. If the patient states they do not like the more plus option versus the starting power, return to the starting point, and this is choice 1. Introduce minus power by moving the wheel in the upward direction 1 click. This is choice 2. If the patient likes more minus, continue in this direction until the previous choice is sharpest. If there is any confusion, ask if the choices look about the same and give the more plus option. It is a general rule of thumb that each step of change in sphere power should improve the visual acuity by about a line. You do not want to keep going in one direction if the sphere change is not improving visual acuity. You will usually want the most plus or least minus for the best visual acuity. Leaving a patient with too much minus or not enough plus power will cause them to use their own accommodation, which can cause eye strain and fatigue. This is particularly true when presbyopia occurs. However, in a younger patient with good accommodation range, you often do not want to add more plus to their habitual glasses, unless they are complaining of headaches, eye strain, or other visual dysfunction. Because younger people tend to have a lot of screen time and near work, their prescriptions are usually more minused or myopic at the end of the day. So take a look at what power they are currently using. Next, we will use the Jackson Cross Cylinder, or JCC, to determine any astigmatism correction. Flip the Jackson Cross Cylinder in place to check axis and cylinder. It will have 4 dots on the lens, usually 2 red and 2 white. Refine the axis first. Turn the dots on the cross cylinder to straddle the axis. You will change dot positions when the thumb wheel is flipped. In the example below, the starting axis position is 90 degrees. Just as you did when checking the sphere, identify each flip with a choice, 1 or 2. Flip the thumb wheel from one side to the other and move the axis knob, chasing the white dot in the direction desired, starting in 10-degree increments, and bracket the patient's choices. Then move the axis in smaller increments to reach an endpoint by flipping the JCC and asking which is better, 1 or 2 or about the same. If the patient says the choices look the same, that is a perfect endpoint. The higher the amount of cylinder power, the more you want to refine the axis. For example, if a patient has a half diopter of cylinder, they will tolerate a larger amount of error in the axis. They will probably not notice a difference in visual acuity within 10 degrees on each side of the exact axis. On the other hand, a patient with 3 diopters of cyl power will need to be refined within about 1 or 2 degrees of the exact axis. They are much more sensitive to axis error. Next, we will move on to determining cylinder power. Now click the JCC into the cylinder position by aligning P. If the patient selects the choice where the white dot is at P, you will increase the cyl power. Decrease the cyl power if the patient chooses the red dot at P. Repeat this until the previous choice is sharpest, or the patient reports the changes are about the same. Go with a lower cyl power if the patient thinks they look the same. For every 2 clicks or a half diopter of change in the cyl power, you will need to change the sphere power in the opposite direction by 1 click to maintain a balanced spherical equivalent. For example, from this cyl starting position, the patient accepts the white dot choice, so I will increase the cyl power. When I give another set of choices, again, the patient accepts the white dot choice. So when I increase the power again, I have increased the cyl power by a half diopter of plus power from my starting point. So I will move the sphere dial up or in the minus direction by 1 click. If there is no astigmatism correction in your starting point, do a 4-point check at 180, 45, 90, and 135 degrees. Set the axis at 180 degrees and align 1 pair of dots to the axis. Set the cyl power to plus 0.25. See if they choose the white for this axis. If they do, you will then proceed to checking the precise axis as previously described. If they choose the red, proceed to the next axis point at 45 degrees and repeat. You will do this for all 4 axes points to check if they select the white. If they reject all 4 axes points, the patient does not have astigmatism and you can return the cyl power to 0. You have now completed the initial sphere, cylinder axis, and cylinder check. The last step is to recheck the sphere power. Have the patient read the smallest row of letters they can see. Tell the patient it is okay to guess what the letters are. Refine the sphere power in small, plus or minus a quarter diopter steps. Ask them, again, which is better, 1 or 2, or about the same. About the same is the endpoint, leaving the prescription at the more plus and less minus choice. Check the final best corrected visual acuity and record it. Repeat this entire procedure for the other eye. Now, to determine the add power. Flip the Vergence levers on the phoropter to the convergent position for both eyes. Open the oculars on both sides so the patient is seeing with both eyes. Add plus power to the final Maifest refraction. You will usually add an amount based on their age. You should learn this slide or keep this information somewhere handy. Place the near card 14 to 16 inches or 40 centimeters away or at the patient's habitual reading distance, and have the patient read the smallest row. Introduce small increments of plus or minus a quarter until the patient reports best near vision. For healthy eyes, they should be able to read the J1 or J1 plus line. Note that some patients have shorter or longer arms, so you may want to see where their habitual reading distance is and prescribe accordingly. Give a little more plus if their near working distance is closer, and less add if they tend to work at a further distance. If they want glasses for a specific distance like sheet music or a laptop computer, it is best to have the patient measure that distance from their eyes, then calculate the add power based on that distance. Here are some clinical pearls. Remember the order of operations: initial sphere power, axis, cylinder power, then recheck and refine the sphere again. Push plus in most cases. Don't give more minus without improvement in visual acuity. The patient must prove it to get it. Some patients can be very complex refractive cases. Select the straightforward cases to start with. If a patient has a complicated history such as keratoconus, irregular corneal astigmatism from a transplant or corneal disorder, complications from surgery, disease where the central vision is significantly affected, double vision, stroke or brain injury, or severe dry eye, they will likely need to be referred for a refraction with an optometrist or someone who is more experienced with these conditions. Give clear and simple instructions. Be patient to avoid frustrating you and your patient. Try not to offer more choices than necessary to establish the endpoint. Patients will get tired, and this can result in poor responses. Encouragement goes a long way, especially when you are working with a patient that is difficult to refract.